Welcome to the EarlyON. My name is Katrina and I'm a resource consultant from Lansdowne Children's Center. Today I'm going to share with you tips on toilet training. So let's talk about toilet training. When a parent may feel as if it's time to start toilet training their child, they may ask themselves some questions before starting the big process. Is my child ready? Is one of the big questions on all parents' minds. We can think of a few things when considering this. 1. Has my child shown an interest in the toilet? 2. Have they indicated to me at times they are wet or soiled? So in other words, are they aware? Number 3. Have they stayed dry in their diaper for at least a 3 to 4 hour period? 4. Can they pull their pants up independently? Number 5. Will the household schedule lend to a successful environment? The above list makes us think about some of these key points. It will be easier for this process if your child is showing the signs of readiness. As parents, we may want to think that just because our child is a certain age, they are ready or should be ready for training. In reality, there's no perfect age if they are a boy or a girl. As a child transitions from toddler to preschool, they become more aware of their bodies and the control of it. Has a child been exposed to the bathroom routines watching mom and dad or sisters and brothers? Do they attend daycare and have been part of the routine by watching their peers? They may have asked to sit on the toilet previously or are very interested in washing their hands with you after using the toilet, which is all part of the routine. Are there certain points of the day when the child has their regular routines for soiling their diaper? Have they approached you when the diaper is soiled and indicated so, and have asked for you to change it? When a child has a longer stretch between their soiled diapers, it indicates to us they're starting to have more control over their bodies, and this is key for success. Being able to wait a little to get the washroom is a sure sign of success. Sometimes bathrooms can be far away for a little one. When we talk about independent skills, it's important for us to encourage children to do the routine as independently as possible. Success will come with a great value. Stocking up on loose fitting pants so that they can be pulled up and down with ease. Consider how and where would be the best room in the house, as well as will the big toilet be used with the aid of a ring, or is purchasing a potty better for your household? If you are a one bathroom house, maybe a potty would not be a bad idea. Toilets are fine, but consider a little stool for the child's feet so they will feel safe and secure. Not to mention it's easier to push sometimes if your feet are supported. Remember, toilets can be high up on some children, and if they're feeling unsure to start with the toilet, this adds to a whole new dimension, especially if your pants are around your knees and you feel like you may tip. The last point is, how busy is your home environment? We want to make it as easy as possible for your little one to have a predictable routine, so that may feel comfortable and they're familiar with their surroundings at first. There are many resources in the way of books and videos that can be interesting to your child. Don't be afraid to talk about the basics when your child has an accident and how does it feel. You can use language like, "Oh, I see you are wet. Let's go to the bathroom and change your pants so it's not so cold." Parents can talk about their toileting. "When I get up in the morning, I really have to pee. I like to try and go to the bathroom before bed so I don't have to get up. Sometimes after mommy eats her lunch, she feels like she has to go to the bathroom." Let's talk about your child and if they attend childcare. If your child attends childcare, this is a resource in itself. Speak to the early childhood educator about your interest in toileting and ask about their routines, and you could work as a team to have consistency. Do they have a visual strip with steps they follow when using the washroom for toileting and washing their hands? If so, ask if it's possible to get a copy of this for you to use at home. When you're going through the washroom routine at home, please try to be consistent as possible in order for your child to learn this self-help skill and build on their independence. You may want to introduce a sticker reward chart that's up on the wall in the bathroom to reinforce their successes. Again, this would only be used if it's consistent with what your child is using at a childcare. It's very important to also provide your child with opportunities to explore the washrooms in other settings, such as the mall and the grocery store. We want them to be comfortable using the toilet wherever they are. If you would like to involve your child in a little more, you could bring them to the store to pick out some underwear for them. You may want to pick out underwear that has their favorite characters from a television show or their favorite colors, etc. By choosing with them, it helps to motivate them into wanting to wear them and also in not wanting to get them wet. Remember to get lots though, because there will be accidents and you may need 4 to 6 pairs a day. Your child can even pick out the potty, and maybe before the big start, you can bring it to the living room so they can start to get comfortable on it. Remember to stay positive. Accidents will happen, lots, but it's a big routine to get used to. Praise a child for trying. If they don't want to sit, don't pressure them at first. Remember, modeling sometimes is a motivator. Have the parents sit and use the toilet, finish by washing their hands. Try again in a little bit. Some parents ask about whether or not they should use rewards, such as stickers, toys, food, etc. Positive reinforcement in the form of treats can be an effective part of toilet training. You only want to use them in a short period of time and should only be used if they are being consistently used in all of the child's environments, such as their home environment, childcare, and other homes that they may visit. Setting up a simple potty schedule is key. You should try your schedule in the beginning to be every 30 to 45 minutes. Try having them sit on the potty for 4 to 5 minutes when they wake up and after meals. Those are the times when most children are likely to have a bowel movement. Offer praise and attention, even just for trying. Here are some tips on starting to potty train your toddler. Switch to underwear so that if you do soil, they will feel it against their skin. Watch them closely for signs of when they will be needing to use the potty. Do they do a little dance, or maybe avoid being near someone or going off to the side of the room? Teach them how to recognize when it feels like when they have to use the potty. Talk to them about their body and how it might feel. Be patient, provide lots of drinks throughout the day, and decrease in the evening. Remember, it is not uncommon for children to have a relapse, especially if the training was done with great success and now things may have changed a bit. Less emphasis on routines of the day or perhaps a new baby in the house. Keep at it and it will come. If for any reason you feel there was a concern about development or medical issues, please consult a medical professional and let them know what was happening. Good luck and happy pottying.
A resource consultant from the Early Integration Program is available to talk to you should you want more information, support, or to discuss any concerns or questions you may have. Please contact us by email at eip@lansdowncc.com or by phone at 519-753-3153. Ask reception if you can speak to a resource consultant.